Hello and welcome to another episode of Navigating Cancer. I'm Dr. Joey Bennett along with Wendy Hall, who is our social worker from the Robert Boisneau Oncology Institute. And we have a special guest today, and this is not the special guest. Our special guest today is Dr. Mark Hashim. Dr. Hashim is a board-certified pain management specialist. On our previous show, we had talked about using narcotics and kind of my ideas about how I manage pain from a cancer standpoint. But very often I will realize that it's out of my hands, that things are not working right. And so when that happens, I always turn to Dr. Hashim and ask him to step in and help with the patient. So, thank you very much for being here.
Thank you for having me.
Yeah. Tell me generally kind of what is a day like in the life of a pain management specialist?
I want to tell you that what we do in chronic pain management is we see a lot of patients who've had problems for a number of years, and we try to find the source of the problem and treat the problem. I am a firm believer that you can use our current modalities with minimal or no narcotics to try and control their pain. So we see a lot of patients that suffer from problems from the head to toe, and typically it can be headaches, it can be neck pain, or pain shooting down the arms from a disc disease in the neck. They can have problems in their thoracic region, such as postherpetic neuralgia, which comes from shingles pain. Mm-hmm. They can also suffer from pain from radiation neuritis, or chemically induced neuritis from treating cancers.
A lot of the chemotherapy drugs we've talked about.
Yes,
exactly.
Yeah.
Yep.
We see that a lot with multiple myeloma, actually. Mm-hmm. Mm-hmm. In addition, we deal with the low back. Millions of Americans suffer from low back pain. I will see patients that have not been operated on. I'll see patients that have been operated on. They'll suffer from low back problems, and they'll have problems shooting down into their legs. So when we see these patients, we need to do a thorough workup, find out what the cause of the problem is, and try to initially start with a conservative treatment to control, what I say, control their pain. I want to emphasize the main thing in pain management is dealing with the patient's quality of life. People suffering from chronic pain, it has a very negative impact on numerous levels of their life. Their job or their inability to work, their home life, their personal relationships, their ability to function on a daily basis, their ability to sleep. Mm-hmm. So when you drag all this together, you get a very complicated patient. Yeah. And the goal of a quality pain management physician is to improve the quality of life. And that's what I go after. And I'm a firm believer that narcotics do not improve the quality of life. They are indicated in certain times, but most of the times we can find a way around that, and we're not loading people up with dangerous drugs.
And it's one of the things that he and I discuss a lot. From my practice, a lot of times we do need to use the narcotics because we've got cancer-related pain. But I would guess that, I don't know what percentage of your practice, but a large percentage of your practice is not related to cancer.
That's right. That's right. A very small percentage is related to cancer. Cancer is very challenging from the pain perspective on how to go about treating the patient. But in general, most of the patients have other problems that are causing the pain. Disc disease, arthritis of the back, or
what about injuries?
We do see a lot of, you're going to see a lot of workplace injuries that lead to a pain in the back, or then had operations on the back and now have what we call post-laminectomy syndrome. The back's been operated on 1, 2, 3, 4 times. They still have a problem. Mm-hmm. And in my world, the definition of insanity is repeating the same thing and expecting a different outcome, because it's not going to happen. Yeah. So that's when we have to start to use our talents to improve matters for the patient.
Now, I'm assuming when you first see a new patient, whether I refer them to you or if it's somebody who calls your office because they've got one of the other problems, one of the first things you're going to do is spend a lot of time, very thorough interview with them about how long, type the pain, talk about that process.
Exactly. What we need to do is get a thorough understanding of the patient's history. What are other medical conditions do they have that could be contributing to the problem? And then what specifically has been going on with this problem? How long has it been present for the patient? And how many different treatment options have they tried? Have they thoroughly exhausted all options, or are some of the options still available? And if some of them are available, then after our workup and after us doing extensive studies such as MRIs or electron micrographs, EMGs, then we find out how we want to go about treating the patient.
And you've got several different avenues that you can start with. I know you have access to all the medications that anyone has, but you've always been very proactive at looking at other ways other than narcotics to do these things. I mean, what kind of goes through your head when you see somebody, say, with chronic back pain? You know, if they're coming to you and they really haven't done anything but take some Aleve or Advil or something like that over the counter, what's your first approach?
My first approach is to work on their physical capabilities and actually get them into a good physical therapy program, because physical therapy, and even you can add in chiropractic therapy, can do wonders for alleviating their symptoms. So I'm not quick to jump on aggressive treatments if the non-aggressive conservative options have not been fully explored.
But you've got a huge arsenal of what you can. When we had spoken before on a previous show, Wendy and I talked about all the different medications that are out there. You've got the capability of doing focused therapies in multiple different ways, either in your office or actually utilizing one of the hospital or operating room type facilities as well, right?
Yes. When we come to procedures, those are pretty much done in my office. But when we talk about medications, we now have a lot of non-narcotic medications that we're using. Some of the antidepressants are extremely good at controlling low back pain, arthritis pain, neuropathic pain, or diabetic neuropathy pain. We have some of the anti-seizure medications that are also very safe and very effective at treating these types of problems. So we can start with therapies, non-narcotic medications, and then if we need to, we can start to proceed with interventional techniques.
And I think one of the advantages that you offer too is that, I mean, since you deal with all these medications, you understand the side effects and the things that people are going to deal with, because, you know, almost all these drugs that we use are going to have some sort of side effect. And you and I are both firm believers of being proactive about what's coming down the road and how to correct it, right?
Exactly. And so you want to initially tell the patients what medications they're getting involved with, what cross reactions they can have with other medications, and what side effects they're going to potentially get into. And if they get into the side effects, you have to quickly come off and get rid of that medication and eliminate it from the toolbox and look for something different.
And we don't have this here just for a prop today. We're actually going to use it. When we come back in the next segment, we're going to get into some of the really focused procedures that Dr. Hashim can do in his office for chronic back pain. So stay with us.